And usually, if I palpate down towards the inferior angle of scapula, sometimes more towards the side, sometimes more serratus anterior. Oh, there it is. Yeah, you can see her jerk. Thank you. You communicate really well without saying a word. Okay, so in her case, it's kind of the border of the serratus anterior, almost edge of the lat. Okay, kind of area for you. Again, muscles as place markers rather than as targets. Okay, I'm not going to go in there and try to scrub your serratus anterior or something like that. But what we're going to do is we can see if we can calm this area down. Okay, so I might sit or stand, but I'm going to shift now more to this angle. And what I want you to let me know is, first off, I'm going to just kind of let this prop up here. How does that feel okay in your shoulder?
Yeah.
Okay, so what I'm going to do at first is I'm going to just get a little grip. I might go without the Dyson. And I'm just going to draw the skin up away from that spot. Is that still okay in your shoulder?
Oh, yeah.
Okay.
Drawing.
When I press in here,
that's super sore.
that's super sore, right?
Yeah.
Okay.
So you're drawing with your right hand there.
So my right hand is just marking the spot. My
Okay.
left hand is drawing the skin,
Okay.
pulling the skin up towards her elbow. But that's super sore for her right now when
Okay.
when I try and do that. So what I'm going to do instead is I'm going to get a little grip on her forearm. Go ahead and let your elbow bend. Perfect. Is that okay in your shoulder like that? Okay. And what I'm going to do now is I'm going to just support it against my body, and now I'm just going to take the skin around her forearm. Okay. It's not quite as extreme of a position for her shoulder. When I press in here now, how does that feel?
It's less sore.
Excellent. And now I'm just going to draw this just up and across just a smidge further, and give that a few seconds. And how does that feel?
I feel it, but it doesn't hurt, you know?
Okay, perfect. So she hasn't gone numb, good. Doesn't hurt, also good. That's where I'm going to stop. Okay. I'm just going to hang out here. Okay. So some people are going to you're going to not have to take the arm quite as far, or maybe that first thing where I was just stretching the arm up towards the skin up towards her elbow, maybe that'll be enough. But for her, this is much more comfortable for her. So I'm standing up again. I've got a grip on the skin up here and rotating it around her forearm.
And the rotating around the forearm is creating what direction?
It's just adding a little bit more pull of the skin, but I think part of it is that it's also non-nociceptive sensory input up here, closer to the hand, which is going to be a much higher priority to the brain than this area down here. So it's a little bit of a distraction as well.
Okay, so that's providing a distraction because it's closer to your hand up there.
It's closer to her hand.
It's closer to her hand there.
Yes.
And so it's not doing anything as far as creating a tissue pull or tension under your position.
Because I've already stretched the tissue in this area here by moving her arm. But I'm just adding a little bit more non-nociceptive sensory input here.
Yeah, and a stronger hold of, a firmer hold of, secure hold of that arm up there.
Yeah, because by pitting it to my body, she knows it's not going to go anywhere.
Okay.
Her autonomic nervous system knows that her arm is in a stable position.
Now, is there a wrong way to stretch the skin? Like, if you did it opposite?
A direction that makes things worse.
Okay.
Or which they don't like. That would be the wrong direction.
Okay, so there's no right or wrong until the client lets you know.
So, well, ask them.
Yeah.
Because they usually won't tell you until you ask.
Yeah.
It's